listening to On the Couch with Carly. Carly's Couch is a safe space to talk. I'm a psychologist, but I'm not your pipe-smoking, tweed-wearing stereotype. Hello, and welcome back to On the Couch with Carly. I am excited to introduce Catriona Boffard, a clinical sexologist, psychotherapist, and sexuality researcher who is truly changing conversations around intimacy and sexual well-being. Catriona is currently completing her doctorate in psychotherapy and is an internationally recognized expert who's appeared on TV, radio, and spoken for organizations worldwide. She hosts the podcast Asking for a Friend, which tackles those topics around sex, intimacy, and relationships that we might feel too embarrassed to discuss elsewhere. Catriona is particularly passionate about helping people who face challenges in their sexual experiences, especially women dealing with sexual pain. Her mission is simple but powerful: to give people permission to talk about and explore sexuality so we can change the narrative around these important aspects of our lives. She runs a global practice and teaches at the Clinical Institute of Contemporary Sexology in the UK. Welcome, Catriona.
Good morning. Good morning. It's so nice to see you, even on a screen.
I know. So Catriona and I follow each other on Instagram and haven't had that much interaction, but I reached out and said, will you please be on my pod? Because, to be honest, sexuality for me is such an important part of being alive, and it is such an important part of therapy for me. As a therapist, I often, engage with people's sexuality as a significant aspect of their life force, as something that I believe tells us so much about ourselves, who we are in the world, and what we desire. Is such a beautiful topic to, it's one of my favorite things to talk to clients about. And then obviously to help people with some of their struggles, their shame around sex. And I'm an anti-shame person in general, but I think we have to really, really be so mindful about how much shame is around people's bodies and sexuality. So I'm so excited to talk about sex. And every time I talk about sex, whether it's on the podcast or with someone, I always want to sing that song from the 90s. Let's talk about sex, baby.
You're not the first person. Let me tell you, Carly, you're not the first person.
And I have to admit that I'm talking about sex, with you is such an exciting thing for me, and always an exciting thing. Like if I have a girls' night, it's like, I want to get down and talk about the stuff, with my friends. And I was super excited about this conversation, but I'm going to be very upfront. I've had a hell of a morning with my children. And I feel like I am up here with just, I don't even know what to call it, the stress and the overwhelm of it just
being needed.
Of like absorbing little people's big emotions. And it just made me think before we got on this call, how much that must be such a universal thing that, like, for couples, particularly struggling with their sex lives, like, how do we do this after we are parents all day long or whatever, So yeah, I just thought I would bring that up just to have like a real talk disclaimer that I'm just like, shit, man, I'm not feeling really sexy right now.
You know what? I want to speak to something that you mentioned just now about being kind of openly comfortable to talk about sex with your clients, because it's just so often, and it was a big part of the research that I did in my doctorate, that clinicians don't feel comfortable to talk about sex, and so they feel their own shame, so they don't offer it as a topic of conversation to their clients, and so they need to refer out their clients, or their clients don't think that they can talk to their therapists or their doctors about sex. And sexual health is just another pillar of our well-being. And I say just another because it is just another with physical, mental, spiritual health, but it's often excluded. So I'm really glad there's somebody else talking about sex openly and freely, because that's what people need. We need permission to talk. And then when it comes to the kid thing, oh boy, do I get you. My son this morning, everything was, I need you, I need you, I need you, I need you. That was the demand. And I just am so aware of how much as a parent in just that role we are demanded of on a day-to-day basis. And it doesn't stop when your kids are independent. They're never really fully independent, I don't think. I mean, I still think about the relationship that I have with my parents and how there is often dependence on them in different ways than my 3-year-old has. But that demand is not great for are already depleted levels of energy. And that energy that we need in order to create connection with our partner and to have kind of meaningful intimacy. So being demanded of as a parent, being overwhelmed, overstimulated, none of that really provides us with capacity at the end of the day. And that's usually when two people get time together. And honestly, like, I get it. I get it why two people who are, decided to do life together, maybe, and have had children together, just want to sit and doom scroll. I genuinely get that, deeply resonate with that. And at the same time, we've never been more disconnected relationally than we are nowadays.
Yeah. I feel like I have so many questions swirling around as to where we can start this conversation, but I think let's just start really, really, really fundamentally. What is sexology? What is it that you feel is the work that you do and the space that you offer your clients that someone who's listening right now would be like, right, I have this thing. This is where I take it.
Mm-hmm. So firstly, sexology is an umbrella term, and it's the umbrella term that defines specialist, like a specialist in the field of sexual health. Psychology, oncology, the ology part is the specialist part. And so sexology is a specialist in human sexuality. And it's an umbrella term globally that actually encompasses a lot of different professional approaches and clinical approaches, from research. You can be a sexologist if you're a researcher, and you can be a sexologist if you're an educator. But in the work that I do, I'm a clinical sexologist and I work clinically. I see clients on a day-to-day basis and I'm working clinically with them in my practice to help them navigate through difficulties mostly. That's the predominant reason why somebody would come to see me, is that they're struggling with something in their sexual experience. And it's very interesting that most people have a certain expectation of themselves sexually, and that often isn't based in a very realistic or compassionate or real, I suppose it's realistic, considerations of sex. Their expectations of themselves sexually are based on what they've heard, what they've seen on porn, what they've been told by a partner it should look like, what socially, culturally, even religiously we're told sex should look like. And so people are coming to see me to say, something's wrong with me. I feel broken, or they're broken, fix them. And I don't know what to do. And this is really deeply difficult and really shameful. So the majority of the clients that I'm seeing, both individuals and couples, I'm working with people who are struggling with their sexual experience. But sexology and myself as a clinical sexologist, I treat a range of things that have got to do with human sexuality. And that includes gender as well, includes reproductive health. I worked as a termination of pregnancy counselor for many, many years. And I did my master's on how cisgendered women experience their sexuality following a termination of pregnancy, because again, it's just left out of conversation. And it's just so interesting how in the time that I've been practicing, and that's for 13 or 14 years now that I've been doing this work, how I've seen so much change, and yet so much has stayed the same in terms of the shame that we feel around our sexuality. And within the South African context, we have quite a conservative society, and overall we are kind of net conservative, I'd say. And definitely with kind of the advances in, I don't know, social media, in access to information online, there's a change in what we know about ourselves, but there's still so much stuckness around what we're taught and how we see sex represented on screen. There's still a long way to go. So my work is just really trying to help people understand that there's nothing wrong with them, that they're clearly struggling with something that is impacting their ability to enjoy themselves sexually. And it's deeply rewarding work, but I do think often I speak to people and they say, oh my gosh, you've got such a cool job. And I do. And it is my passion. And I'm very fortunate to feel so passionately about it, but it's hard work. And you'll know this as a therapist that, we are seeing people's rawest forms. We're really working with people when they're in a space of deep pain and suffering and struggle. And I'm seeing the exact same thing in my practice. And both you and I will want to get people to a space of not experiencing that anymore, or increasing their ability to tolerate the distress or the pain, or to change the way that they're experiencing their day-to-day lives. And so the work that I do is really just to ensure that people feel better. They feel happier. They feel more content. They feel more autonomous. They feel more confident in the way in which they're experiencing sex and relationships in their bodies.
Okay. And what made you go this route? Is there something in that you were attracted to in particular when you were doing your degree, or how did it come about that you decided to focus?
I definitely wasn't a 4-year-old saying I wanted to be a sexologist. Definitely wasn't happening in the late 80s, early 90s. I went to university not knowing what I was going to do. I really just went because I thought that's what I should do. And I studied psychology because I thought, it's quite interesting. And I actually was studying industrial psychology first. And then I changed to clinical track, which I was thrilled I did because I found it a lot more interesting. And I had one 45-minute lecture in and the language around this is so terrible, abnormal psychology module in third year. And I was sitting in this lecture, and we had a fantastic lecturer, and she started saying things in this 45-minute lecture. The lecture was on sexual dysfunctions. It's a topic. Language is very interesting. Don't love the language. She started saying words like vaginismus, which is a sexual and a penetrative pain disorder experienced by people with a vagina, anorgasmia, which is difficulty to have orgasms. Kind of sat up, thinking to myself, I've never heard these terms before, but you're talking about my body. You're talking about I identify as a woman. I have female anatomy. Why have I never heard these terms? And at that time on 702, which is a talk radio show in Gauteng, they used to play erectile dysfunction ads on the radio at 7:00 in the morning. So I'd be driving to varsity, and I'd hear these adverts for, male sexual health, but I'd never heard these terms. And so I asked girlfriends of mine. Now we're all kind of, third and fourth year students at university. I'd never heard these terms before, and they had not heard them either. So I started to think, why are we not being told about this? This doesn't make sense. And so I started to get really curious about it. And I then kind of was introduced to Professor Elna McIntosh, who within our field in South Africa, within the field of sexual health, she's kind of the matriarch of our field. She was really one of the first people to bring these skills, the services of a sexologist to South Africa after studying in the US. And I went to work at her sexual health and reproductive health clinic in Johannesburg. And she, rightly so, has had many students come through her doors to say, I want to be a sex therapist. And, she was really good at saying, do you really? Do you know what this work entails? It is not all writing for Cosmopolitan and being on the radio. It is deep, difficult work. And I had a conversation with her when I saw her actually last week. And she said, I could see that you really were interested. There was something within you. And so she gently and or forcefully pushed me in the direction of specializing it in this field. But to this day, still, that was 2009. Still to this day, there's nowhere in South Africa that you can do a postgraduate diploma or a postgraduate qualification in sexology and human sexuality. And so that requires you to have the resources in order to go overseas to do it. And I've kind of grown up between the UK and South Africa. So having more access to international courses, I was able to do that. I was able to study further and do a master's in it, specifically in, I think the title of the master's is like HIV, STIs and sexual health. And it was the counseling stream. And what is fascinating is coming back to South Africa with that degree was being told I was underqualified and I couldn't get registered in South Africa and I must go and do more training. And I've done so much training now that it's stupid, but I am an eternal student. And South Africa is still not recognizing this as an important part of our lives. It's so frustrating. But yeah, it's still that there is a huge lack. We're just lacking this aspect of health being considered as one of our fundamental pillars of health in South Africa. Yeah. And that's what makes me want to continue to do the work within the South African context, especially.
Yeah. Sure. It's so interesting here. And I'm thinking about sort of all there's like a undercurrent of feminist, you know,
Yeah.
suppose activism in what you're speaking about, this idea that sexuality in general isn't given enough space, but we know that female sexuality in particular, or, I think the idea that even the way the porn industry is constructed, it's very much around what men's sexuality is about, or at least what we're told it's about, whether it's accurate or not, but that what is there really about? And I mean, there's lots of, we know now that there's just been this crazy disparity between how much science there is about women's bodies and how much science there's about men's bodies, or, the research is so lacking. But okay. So let's zoom in for a section. So talk to me about something like vaginismus, or what is the term used? Anorgasmia. Anorgasmia. So
anorgasmia.
Are there like common features or like typical etiological pictures that you're seeing with women who come to your practice with these problems, or is it very varied across the spectrum?
Sure. And you want to speak specifically about kind of people identifying as women?
I would say people with vaginas. Let's start with that.
Oh, sure. Okay. Yes, if you were to ask me to write down a list of things that are correlated more commonly to experiencing difficulties in the way you experience sex, I would be able to give you a list, and I'll talk through them. And at the same time, it's not an exhaustive, conclusive list. There are so many reasons why somebody would experience difficulties, and something like vaginismus as a penetrative and pain condition may have different etiological kind of roots than something like anorgasmia, which is a difficulty experiencing an orgasm. But the predominant things that I see in my practice, I'm seeing things like strict messages around sex and during your upbringing. So that can really come from culture, come from religion. It just can come from your family. It's what we inherit sexually in terms of the messages we get. So I talk to clients about the blueprint that they have been given to their, brain, and the brain is their kind of, or the sexuality home that they have. And the brain is the most important sex organ. So speaking about the blueprint, what does the blueprint look like? What were you handed? What were you given? And what rooms were added on as you grew up? So strict messages around sex, messages that were shaming, even going so insofar back as like toddlers who have their hands in their pants, and being shamed for doing that, when it's a very typical developmentally appropriate thing. And kids have no idea that it's got anything to do with, what adults view as sex. They just think it feels nice, much like tickling your arm feels nice to some people. So there's that. There's religious messages around sex. And the research shows us that religion is not great for our sex lives. There is wonderful evidence that shows actually having a meaningful and deep religious kind of a value system can be very positive actually for your sexual relationships. But it's not great because of what religion tells us. Most religions say about sex. Culture is also another thing. Culturally, what is acceptable and not acceptable in your community when it comes to your body, when it comes to sex, when it comes to relationships. Trauma is obviously a big one. Child sexual assault, child sexual abuse, adult sexual assaults, things like that, gender-based violence, none of that is good. But again, it's not a direct correlation. Just because somebody has experienced that in their life does not mean they're going to experience sexual issues. Then in terms of kind of more present-day stuff as adults, negative sexual experiences, relationship dynamics, high stress, parenting. Then we have to look at kind of the biomedical side, medications that we might be taking, the type of brain that we have, things like ADHD, autism, OCD, neurodiversity needs to be taken into consideration as to why and how we might be experiencing or not experiencing something that we want. And education, which is a huge factor, because generally, and this is particular in the South African landscape, we don't have a pleasure and consent focused education, sex education curriculum. we are like the USA, not as bad, thank God for that, but we are like the USA in that we have kind of a risk and safety focused sex and education curriculum. And I think there was a lot of uproar within the last few years when the Department of Education was changing the sexual health curriculum. Parents thought that their children were going to be taught how to masturbate. It's not the case. And actually, just as an aside, if you look at countries like the Netherlands, where pleasure and consent is the focus, they have a much better sexual development trajectory than countries that are risk and safety focused like the US or South Africa. And so that's a big part that's missing out of the conversation. And so it's such a big range. We need to consider the bio, that's the medical, physical disabilities, what's going on in your brain and your body, what medication are you on, what chronic illnesses do you have. Then we need to look at the psychological, your mental health, your experiences growing up, trauma, the messages you received, and the social, the environment that you're in, the stresses that you have, the relationship that you have. It's multifactorial. And that's why when I work with my clients, I just don't think there's a one size fits all model. Every client's story is unique and has to be listened to in a very kind of unique way.
Absolutely. Yeah, that makes a lot of sense. And there might not be a one size fits all answer to this one either, but in general, what are your kind of treatment interventions that you're working with?
Yeah, it's tough. To be very honest, the number one thing, which is actually sounds so basic, but is one of the most important and meaningful things, is giving people permission. It's actually saying to people, you're allowed to not want that, or you're allowed to want that, or there's nothing wrong with you for feeling deeply afraid of having sex, and please don't try and grit and bear it just to make your partner happy. And why would you want to have sex if it's not enjoyable? So it's really offering permission to people that they've never been given to have them realize that there's nothing wrong with them and they don't have to do it the way it's been done or the way they've been told it's been done or have it done to them. So permission is actually just a fundamental thing. And, you said it earlier when you said about, the way that you approach sex in your practice, even just opening the door for a client and saying, if you've got any questions about your experiences of sex or you want to ever talk about that, let me know. We can talk about it here. Even just opening the door for people as a healthcare provider, whether you're a psychologist or a doctor, is permission. Or even just saying to them, look, I hear you raising this particular experience of your life and I don't really have any knowledge of it, or I feel like a little bit uncomfortable in it and I don't want you to have that experience. So let me recommend somebody who you could see, who would be able to offer you a safer space. Because feeling safe is not just crucial for people in their experience of sex. It's fundamental. It's an absolute non-negotiable. Feeling safe, feeling connected, feeling, that they matter as they are. But it matters in the healthcare space as well, that somebody is feeling that they're safe, feeling that they matter, feeling that they are okay as they are. So there are so many specific interventions based on what somebody's presenting with, but we've got brilliant evidence to show that things like mindfulness, outstanding for your experience of sex. And that's practicing kind of mindfulness and kind of getting more into your body outside of sex, so that when you are experiencing sex, you are less up here, even though this is your most important sex organ. The thinking part of your brain is not useful during sex. Your body is the important part during sex. And too many people are up here worrying about something or thinking that they need to, be doing something differently and having fear, having shame, having doubt, and feeling disconnected and feeling maybe just as a vessel, feeling just that their partner wants sex, not I want you. So mindfulness is a great evidence-based approach. I mean, in terms of the kind of therapeutic approaches, I work pluralistically, which means that I have a lot of training in a lot of different things. And, sometimes cognitive behavioral therapy is very useful. And other times attachment-informed therapy is very useful. And then I'm going to be using EMDR, eye movement desensitization and reprocessing, to help with trauma and shame, or phobic responses, which is actually, there's a lot of research around vaginismus being a phobic response, in the way that the body responds, much like one would to a spider or, like the fear that happens in the body. And then, retraining of the brain sometimes is really necessary. Psychoeducation is crucial. Oh my God, it's such a huge part of it, psychoeducation, because we've not been educated in a way that's actually accurate. So helping people to understand what it should actually look like and being culturally, racially, religiously sensitive when you're doing that. Then if you're working with a couple, then it's just couples-based approaches, but it's so nuanced. And that's why I don't like to apply a one-size-fits-all model. Because every human being that sits in front of me and tells me their story about how they're experiencing themselves sexually, it can sound similar to the person who I spoke to before them, but it's not the same. Everybody's different. There's nuance to it that has to be taken into consideration at the time.
Absolutely. And I think also this idea of being in your body is for me, feels like it's becoming more and more of a challenge in our society that people are not embodied. And the more we rely on technology and the way the technology is designed is such a cerebral interaction that is so like, it's here rather than us being in our bodies. And actually, like, even just the fact that we're so disconnected from, and this I think might be gendered, that then maybe it's changing, but that at least for my generation, there was maybe a little bit of a split where boys, and I'm going to just use this term, it doesn't necessarily feel like it encompasses everyone that I'm speaking to, but boys are socialized in their bodies more. They're given sports, they're just taught to be in their bodies more, and girls, I think, are taught to think more, to use social, verbal connection with their peers. And so I do see in my practice that a lot of women more than men struggle with being embodied, struggle with even just being able to ask themselves, what am I feeling? What's happening for me? What feels okay? When does it not feel okay anymore? And do I feel like I have a right to say, that's enough? That's all that I can handle. I think like the idea of boundaries for women is such a fundamental thing that we struggle with, that we get to say what is okay for us and not okay for us, which I think is part of what can be the fear with sex, is that if I don't feel like I have that agency and that I don't have that autonomy to say what is okay and not okay for me, then I have to go all in, and going all in feels terrifying. And so I don't know, I'm just free associating here, but that's what I was thinking about when you were speaking.
And I agree with you and I disagree with you. So I absolutely agree that within our cultural construction of gender, we are socialized in a particular way. Even if you just think about like, oh, blue is for boys and pink is for girls, it's just a social and cultural construction. There's no hard and fast rule. So already from very early on, from a gender reveal perspective, like there's a socialization in different directions. But I disagree with you, because I think in the fact that there are different directions and constructions of our gender kind of representation and how we present ourselves to the world in a gendered way, even with the kind of masculine and feminine, men are really struggling because they're told they shouldn't have feelings, and they're told to just suck it up. And they're seeing representations, really unhealthy representations of masculinity online that show them very vastly different experiences from what's actually happening for them. So I absolutely agree with you about women, but I see so many young men, I'm talking like under 30, who are really struggling, and they don't know why they can't have experiences like their friends are saying they're having. I often think there is something that is where, from a gender perspective, that I think, if we're talking in the cisgendered frame, that women do better is they talk more, they open up more, they're more willing, and we know there's evidence that shows women are far more willing to seek help than men are. But the narratives around in kind of male circles are not around feelings and around holding a boundary for yourself and giving yourself permission and not being okay. So I don't think that if we speak about those two binaries, that there's any favors being done to either. And particularly with, in Western culture, in kind of a South African landscape, even if I think more globally, like in the UK or Australia or the US, that's still the case. That really is just still the case. That there are this kind of inherent socialization that we're also, we're seeing from our parents. Our kids will, I hope, see something different from us. I know it's a path I'm very, very determined to travel down, that my son will know that he is allowed to choose to wear whatever color he wants to wear. He can choose to play with whatever he wants to play with. It doesn't say anything about his gender, his sexuality. It's just a simple, this is what I want to do now. And to know that he can have feelings and he can express his feelings. And similarly that, my friends with their little girls can do the exact same. That there isn't this rigid structure that exists about what you should do and how you should do it, that we're kind of socialized into. But I do agree. And I think about my parents' generation, they're kind of in their later seasons of their life. And it's a very different thing. And I think we've come a long way, but I don't think we've come far enough. There's still a long way to go.
But I think what you're saying is super interesting, which is about the sort of like generational, I don't want to say divide, but maybe the differences generationally, because let me just say what I experience, and you can tell me whether you think this is an accurate understanding. But I would say that like the younger generation compared to our generation are still quite in the binary mostly. And, the younger generation seem to be way more au fait with the spectrum of sexuality and gender. And like, for example, people that are in their early 20s or whatever right now, they have terms that we didn't even know existed to describe themselves, like pansexual or, whatever it may be. Situations. We'll add that. That was just called dating a fuckboy.
That's exactly what it was. Well, now we got ghosting. It was happening. When I was dating 20, 25 years ago, that was happening. It's just that it wasn't so in your face and like offensively, deeply hurtful. But yes, I agree with you. Nowadays, the younger generation, definitely, they have terms.
But also, I think like what I also think about like the younger generations is that they're much more informed by queer culture.
Totally. Thank God.
And for me, queer sexuality is so interesting because it is, in many ways, not obviously as a rule, but in many ways, it is non-monogamous. It is open. We now, have terms like polyamory being, in the heterosexual world as well, kind of overlapping, and a fluidity around, I remember we only learned, I think I was in my internship year at Vestkoppies in Pretoria. So it was like 2012. And there was a woman who came to talk to us about gender. And it was so interesting because for the first time in my life, I heard that there was such a thing as sexual orientation.
Yeah.
Gender. And what was the other, I'm trying to think what the other term she used.
Gender
something else. Yeah, there was something, it was sexual orientation and gender. And anyway, I can't remember what the other word, but
identity, gender expression, gender identity.
That you could be someone, like all body parts on all bodies can be sexually like erogenous, and you can use different body parts in different body parts, right? Like penises go in bums and vaginas and mouths, and vaginas have hands in them and penises in them. And, you kind of, that's a spectrum, but how you identify as in terms of orientation has got more to do with the fact that you are who you fall in love with and want to spend your life with. And that is a different category. Anyway, that was one of the things I took home from that discussion. But I think that for queer people and how the younger generation has been affected by queer kind of ideology is that is just understood. It's not something you have to learn when you're in your like late 20s in a psychology lecture. Do you know what I mean? And I just find that so interesting. So in my mind, I think I assume, well, their generation must be so sexually uninhibited. They must be so au fait with their own bodies and how to connect with each other. But it doesn't sound like that's the case. So tell me about that.
Oh, you've made so many really relevant points there. And, I like doing my training, doing my internship was like, these terms, these are so interesting. And why I never heard these before. And where's the permission to be who you want to be? And I say to heterosexuals all the time, please go and learn from the queer community. You don't have to identify as queer, but please, there's a lot to be learned from the queer community. And it's nuanced because the queer community had to create their own way of existing in the world and their way of being that to the heterosexual community seems far more open and liberal and, promiscuous. But there are also stereotypes that are associated to being queer, like all gay men are promiscuous, or all gay men are in an open relationship. That's not true. Gay men also want to be monogamous, just like heterosexual people would like to be monogamous, but also maybe they don't want to be monogamous. So I think that the prescriptive, stereotypes that have been given to us, depending on who we identify as, who we are attracted to, are not helpful to our ability to be ourselves. And I think that what is interesting is with social media and the advances that have taken place in social media, we now see, and I know this is a piece of information that's specific to the UK, but kids, adolescents, young people predominantly get their sex education off TikTok and off social media. That is their number one source of it, because they feel that they're completely under supported when it comes to their sexual experiences. But there's also very interesting research that shows, there was a really interesting study done I looked at for my doctorate around how queer women still have heteronormative cognitive thinking patterns because of the social structures in which they exist. So even though, let's just say for a woman may identify as lesbian and associate with the queer community, it doesn't mean all of a sudden she isn't impacted or influenced by the heteronormativity that is pervasive globally. So the heteronormativity that is thread that is kind of woven throughout the generations is still there. We are net overall a heteronormative world. We are a patriarchal heteronormative world. That is the reality of it. And so, yes, you absolutely have a younger generation. I mean, we're talking like Gen Z. I mean, my son is Gen Alpha, and I have no idea what that's going to look like. And I'm not sure I'm ready to explore that just yet. But what we know about Gen Z is there is more acceptance, there is more fluidity, there is more curiosity, there's more creativity. But it doesn't mean that they aren't also influenced by the social structures within which they're growing up and they're exposed to. Because you can live in a city that is extremely liberal and accepting and has, spaces and places, an abundant spaces and places to be yourself, no matter what your orientation is, no matter what your identity is. And you will still be subject to homophobia, transphobia, judgment, criticism. I mean, online is a very unsafe place for a lot of people who want to express themselves and be themselves, and that is outside of the heteronormative ideal. So we've got a long way to go. We really do. And I hope maybe Gen Z can help shift that even more than they already have by being activists, by advocating for the need for kind of autonomy and authenticity in our bodies and our relationships.
Yeah. And in addition to what you just said, I think where my mind just went is just thinking about how, like, culturally we can change our narratives and our discourse around how comfortable we are talking about sexuality. And I'm thinking about myself, even like I'm someone who, I lived in Berlin. I went to parties where people were wearing like fetish gear, and that doesn't necessarily mean that I am in any way less vulnerable or sensitive or cautious when it comes to my own sexuality, right? And I think maybe what I'm thinking about is like, when I think about Gen Z and I think about these young kids who maybe like on a discourse level are saying all the things and, you know, like have all the words and the cultural sort of support to exist on the spectrum. When it comes down to it, when you're in that room on your own with another person, sex is a very vulnerable space.
Deeply.
Learning how to connect with another person and your own body simultaneously is a really complex individual journey that every person has to go on. It's not linear. There's no paint by numbers. We can't just know that it starts here and ends here. It is an exploration, and it requires, like you said, at the very start, safety. And it requires more than that. I mean, maybe you can speak to that, but like if you think about what it entails to actually be with another person and encounter yourself and seek pleasure, but also be there as a body in space, offering pleasure to another person. I mean, that's quite a lot to, and I think, okay, I'm just going to say one more thing before you jump in, but when I think about how we thought about it maybe in the 90s or early noughties when we were like young teenagers exploring with sex or whatever, I think there was this like assumption that you just got on with it, right? Like kids just knew how to like go and kerfuffle in the cupboard when they were doing, 7 seconds of heaven or whatever, it is. And that it later ends up being finger banging. And then later, you're out and you get your virginity taken.
Yeah. Yeah.
Like,
exactly.
I think there's an assumption, maybe this is my heteronormative assumption, that you just kind of, kids just know what to do. They just get together, bodies do their thing, and it's like, sorted. But in my practice and what I understand about being an adult and, I'm like midlife now and I still feel like I'm on this journey, that it's not just like that. It's not just like wham, bam, figure it out. So tell me, about that.
Yeah, it definitely isn't wham bam and what base did you get to, and it's an age and stage thing, right? And I think that this is the other thing. I was saying to somebody at an event the other night who asked me a question about it. Our sexuality and our sexual needs change depending on our age and stage. I mean, we were speaking about parents at the start. Let me tell you, my sexual needs as a parent are vastly different than they were pre-children, vastly different than they were at varsity, So there's an age and stage thing that matters there. And to speak to the vulnerability piece, I've always thought of sex as the most vulnerable space that we can step into with another person. And it's because physically we are at our most vulnerable. We aren't usually naked, usually. The parts of our body that we protect, we wear specific, most people, not everybody wears clothing over. Our genitals, our breasts are covered up, and so we're physically very vulnerable. And then sex is all about letting go. Because if we want to experience pleasure, we have to allow ourselves to be in our bodies, and that requires letting go of the thoughts that we have of the day, the shopping lists, the concerns that we have with our children, everything. It requires us to put aside all of our thinking to get into our bodies, and that is a vulnerable place to be in. And when people really let go and they allow themselves to be in that moment and be with that person in that moment, there's something deeply incredible about that. And there's a fantastic clinician and researcher in North America who, actually, I think she's in Canada. She's in Canada, Dr. Peggy Kleinplatz, who's written about magnificent sex. And she did a study with thousands of couples to look at what extraordinary sex means to them. And no one mentioned how much sex they had per week. No one mentioned how many orgasms they had, or that they got an erection, or that they got turned on. They spoke about being present. They spoke about transcendence. They spoke about expertly communicating, to tell somebody else what it was that they liked. And so being present kind of going into a transcendental space, being able to say what you want, are skills you have to learn. They don't just happen. And to just tie it into some other interesting research, heterosexual women find sex far more satisfying in their mid to kind of later parts of life. And that has got nothing to do with anything other than they no longer care so much about what their bodies look like. They actually just lose the shame and the anxiety and the distress they felt about what will they think about my body. So when people have spoken about, oh, women reach their peak, in their 30s or 40s, no, I actually think it's 40s plus, because they start to just go, this doesn't matter anymore, and I've maybe gotten to know my body. But then there are still so many women who don't, and they don't allow themselves that. So the being vulnerable part it's crucial, but it's a learned thing, but it's also an acquired thing, because you don't just trust somebody the second you meet them. And I have a lot of people say to me, how can I experience casual sex with less emotion? Or how can I allow myself to experience more emotion with a partner? Trust is something that happens through micro actions. It's not just from, somebody rocking up at your house with a bottle of wine, a huge bunch of flowers, and telling you you're beautiful. It's actually the way they show up for you in the moments of vulnerability outside of sex that build trust, that allow you to feel safe enough with somebody. And true intimacy, sexual intimacy, is about being vulnerable, is about letting go, is about knowing that your pleasure matters and believing that. And when you are in your 20s, as much as 20-year-olds are much more progressive than we were, and they have far more access to seeing things and reading things than we ever did. I mean, my grandfather, he was American, and he brought Penthouse magazine to South Africa. Now, for many of your listeners, they'll have no clue what that was, because Penthouse was like, it was a competition to Playboy magazine. And again, many listeners may not even know what Playboy is nowadays, but it was an adult magazine in the 90s, and used to have, pictures of women, but they had to put, little black stars over their nipples, because that was as far as they were allowed to go. And even then there were a lot of legislative things that prevented them from doing more. But that was what we had. We had Emmanuel on ETV, after midnight. And that was where we saw things that were about sex. And we had to figure it out. How do you know? I just know. My cousin's friend told me, or I was playing Barbies with this girl I met one day, and she put the Barbies in this position and said they were having sex. That's how people learned. Nowadays, when I ask clients, how did you learn about sex? Oh, I saw porn, or school, or I saw it on TikTok, or I followed this person. We're learning about sex in a very different way. But still, I see so many people of the Gen Z generation who feel broken, who feel like they're not living up to the expected, anticipated norm, who do not think that they are enough, because what they see is not correlating to what they experience. So there's still, even, for our generation, we have the blind leading the blind. Now it's you have an image of it on porn, and I should be like that, and I should be able to. Porn is acting. Porn is fake. Porn is a falsified and romanticized and fantastical version, and it's a great thing. Porn is fantastic. I think it's a phenomenal tool to enhance our sexual experience. But if you are trying to emanate your kind of your sexual experience based on somebody in porn, or trying to learn about how to be in a sexual space with somebody based on porn, you might as well learn to drive by watching Formula One. It's the same thing.
That's a funny analogy.
Yeah. Time in my profession, and I'm still trying to figure out who actually said it, because we all use it as an analogy. I'll find I need to give credit to the one.
But I think that it also goes to that whole thing of how social media is created, and the dopamine system, and it's, it might be fantastic that we have porn, but we also, if you're used to existing in a simulation of being a Formula One driver, right? If my experience of understanding what sex is by having my brain activated to the degree that it gets activated by porn in the most immediate way, where I just press a button and it's there. We're also seeing that being a really big issue, right? Which is that the actual reality of having sex is not as immediately gratifying. If what you're saying, which I think is such an important point, which is that good sex has got nothing to do with like bodily parts. It's got to do with our ability to be safe and heard and understood and feeling like we can voice what we need. I mean, as you said, it's a lifelong process really to kind of finesse that.
Mm-hmm.
And so we're talking about this idea of like, I should be able to press a button and I get immediately the experience, or I go through a lifelong process, which is, let's be honest, going to be a lot of fumbling, a lot of awkwardness. The gens love the word cringe, a lot of cringe.
There's
a lot of cringe.
There's a fantastic illustrator that I highly rate everybody follows. Her name's Hazel Mead, MEAD. And long ago, I'm so glad I bought a poster of hers, what real sex looks like. And I mean, it's so fantastic. It's got images of like stopping mid-sex to go and get water or put the dog out after vaginal farts or queefing. It's just, awkward positions, getting cramps, in your foot. It's just so honest and real. And that is what I wish people would see.
Yeah.
And it's accounts like hers on social media that I really want people to follow, because that is what it actually looks like. It's not what you're seeing mostly on screen, the romanticized version overall. I mean, we're again, like programs on Netflix like Sexoeducation have helped us come so far. Thank God for programs like Sexoeducation.
Yes. Or like that Goop on Sex. Have you seen that one?
Yes, like Goop on Sex, but I have certain feelings about Goop and some of the things about Goop. Yes, I agree with you entirely. Yes, there's a lot again around permission. There's a lot around being curious. I think that the biggest pieces we've got to take in are that having good sex equals pleasure. Pleasure is only possible if you're feeling connected, if you're feeling curious, if you're creative, if you allow yourself to enjoy it. And the pressure that we place on ourselves based on what we've seen, what a partner's saying to us, their previous partner did, none of that gives space to creativity, curiosity, connection. None of it. It just shuts it down. It just boxes it up. It fills it with worry and stress. And none of that is good for our brains at all.
Yeah. Do you also know about Make Love Not War? Sorry, Make Love Not Porn.
Yes, Make Love Not Porn. Sorry.
Cindy Gallagher.
And her mission to help people understand that porn is not Pornhub. Porn is not what you can access for free. And actually that is, acted and fake. And I mean, if you've actually ever been on a porn set, like a traditional standard porn set, it's really not sexy. It's really not. Make Love Not Porn is about real people having real sex.
Yeah.
And about celebrating that. So yes, what Cindy's doing is brilliant.
Yeah. And it's like, I think what I heard her speaking about is like how when two people have sex, they're like giggling and they're like, asking questions and that it's that awkward fumbling actually. So I have a question for you, and I don't know if you can answer this question, but do you think culture just gets in the way? Because if we were living in the jungle and we didn't have social media, and maybe I guess the tribe would maybe have talks about sex, or maybe our elders would kind of give us some idea of that there is such a thing as sex and our bodies and whatever, we'd be educated a bit. But like, is there such a thing as like two sexually sort of mature individuals, let's say teenagers, coming to get like in the old days, like
mature individuals as a teenager? No offense to teenagers, but I wouldn't have classified a teenager as a sexually, but I know what you mean.
Okay, what I mean by sexually mature is like your body. Yeah, your body is is doing the things that tell you it's ready for sex. Is it like, I guess I have this like fantasy that we wouldn't need to be told about sex, that actually if two people got together, they would know how to figure out sex without the education? Or is that just unrealistic?
Let me give that some thought. You know, I spoke at a really cool speakers event on Wednesday in Cape Town, and I asked the audience at the end to really consider what their sex lives might look like if they didn't feel shame, or if they weren't conditioned to think sex should look like something. Because I think asking a provocative question like that helps us realize how much shame and social messaging conditions us to think it must be a certain way. I'm having a memory or an image. I think it was Brooke Shields on a desert island meeting. I mean, this is from like the 80s, meeting this man on a desert island. You know, I'm trying to remember the exact context of this clip. People will know what I'm talking about if they know it. And him having no understanding of, you know, another human being, and it being her first sexual experience. And the way in which, you know, they just deeply, rawly, that's not even a word, but you know what I mean, in a raw kind of way, enjoy each other's bodies and explore each other's bodies. If there was no script that you were handed, you were passed down, that you saw, you were exposed to, do I think that human beings would just allow themselves to do sexually things with another person and go places sexually with another person in ways that are kind of limited and constricted by social messages? Yes, I do. Because there are certain cultures around the world where aspects of sex are rites of passage, aspects of sex are honored or celebrated, and certain cultures look at sex very differently. I don't want to name, I'm having a slight memory of I think it's in Papua New Guinea, but I don't want to definitively say that. But the way in which our culture constructs the scripts that we have around sex is directly associated to what we internalize. And then we have to go and do the work to unlearn that. So we really are influenced by culture, whether we like it or not. And even the most liberal, kind of open, curious people do still have to do the work to say, I don't want to confine myself and my experiences to this, you know, and work against it, which is tough.
Yeah.
Just tough.
Yeah. Yeah. I just have this belief that our bodies are wise beyond.
I do too.
You know, like that there's some wisdom in us that we know how to connect. We know how to love. We know how to enjoy sex, that it's there in us, and that there's something that gets in the way. And that I imagine, and this is how I think about it with my clients, and I honestly think I'm out of my depth with my clients. I must just refer them on to you. But, you know, I imagine that the work that you do is often just getting that thing out the way, whatever it is, whether it's culture, whether it's trauma, whether it's in limiting self-beliefs, shame, bodily, you know, physiological things that are, you know, getting in the way. Because and I suppose that's what I wish for everyone, including myself, that I can access spaces and moments and relationships that where we can take that stuff and get it out the way and just be ourselves, be human. And in that, use those C words, connection, creativity. And I can't remember what the other word you used. Curiosity, right? Like those words are so, like that what that embodies, like that space to be curious and connected and creative. I mean, I think that actually is where I wish everyone went to in their lives, like overall. Like I think that's where we are at our best in terms of living our lives from that place. And so, yeah, with sex as well. So on that note, because we are running out of time.
I just say I would, because we are, you know, we're existing within the social and cultural confines of sexual scripts. I would add compassion to it. I talk to people about not the 4 C's of a diamond, but the 4 C's of sex all the time, because we need compassion towards ourselves and others, right? We really have to be deeply compassionate with ourselves, that we're not broken. There is nothing wrong with us, but a lot of us have just got to figure it out. And we don't get given the manual. Even if you did, it might not suit your brain and your body. So compassion is the only other one I'd add into that.
Absolutely. And when you say compassion, makes me think of like not perfectionism, right? Like actually being able to know that it's not going to look perfect. It's not going to feel perfect. It's going to be messy. It's going to be inadequate at times, and that's okay.
Yeah, totally.
Okay. Beautiful. Thank you so much for this conversation. I actually really feel like I would love to have more conversations with you. So maybe we'll do follow-ups with like specific topics in mind. If you're listening to this and you have a specific question for Catriona that you would like us to chat about, please send me a message. And I really, really appreciate your time, Catriona. And thank you for doing the work that you do. It's so exciting. Honestly, it's so wonderful.
And thank you, Carly. And thanks for giving me the opportunity to talk about it and being willing to talk about it, because it's other healthcare providers like you that mean that there is more access, that there's someone else someone can speak to. And we just need more and more people, particularly in the therapy world, who are willing to have these conversations and know that you don't have to have, specific expertise and degrees in sexology to allow people to talk about sex and to find these parts of themselves. So thank you for bringing me on and having this conversation with me and doing the work that you do as well.
Thank you so much for listening to On the Couch with Carly. If something in this episode resonated with you or made you feel less alone, that means the world to me. You can find us on Apple Podcasts, Spotify, and now in video format on YouTube. For exclusive content and resources, visit our website at onthecouchwithcarly.com. If you enjoyed today's conversation, please consider leaving a rating or review. It really does help others discover our safe space for authentic conversation. Until next time, please take good care of yourself. I can't wait to be back on the couch with you again.